I'm Dr. Frank Madla III, born and raised on the south side of San Antonio. I'm a local physician, been in practice for 22 years at various hospitals in and around San Antonio. Well, south side of San Antonio, was a young man born and raised on the southwest side of San Antonio, sort of in this area around Lackland Air Force Base. We were actually a little neighborhood called Valley High Gateway, in the shadow of, like I said, Wilford Hall Medical Center and Lackland Air Force Base. My mom brought my dad to the south side of San Antonio because she was working at Wilford Hall as a medical technologist in early 1960s. And we found a modest home. Mom and Dad found a modest home there on the south side of San Antonio, $65 a month mortgage that was within my dad's school teacher budget and Mom's medical technology budget. So much of my life was right here on the southwest side of San Antonio. I spent my first 18 years of life there until I left for Texas A&M College Station, where I received my biomedical science degree, and then went on to medical school here in San Antonio at UT Health Science Center. As a physician, I can tell you that one of the blessings has been, of course, the patients that you meet, the people that you care for. There's nothing more rewarding than helping somebody feel better and get back to a normal life. I was asked to join the board 6 years ago to serve on the New Frontiers Public Schools board. I can preface my answer by telling you that when my father brought A&M to San Antonio to improve access to higher education, his work wasn't done. As I said, my father was an educator for 40 years and a public servant, elected public servant for 33 years. Understood the need for access to higher education, understood the desire from the folks on the south side and west sides of San Antonio to further their education and improve their life by way of an education. So his untimely death in 2006 was a big loss to the educational community. But the opportunity came for me shortly after his death to serve on the A&M Foundation Board. I was given the opportunity to serve with a number of leaders in our community to form that foundation. I spent 10 years on that foundation raising scholarship dollars for A&M San Antonio. Over the decades, a lot of people have contributed to bringing along a lot of good change, whether they're elected public servants, our leaders, our business leaders, just folks who care on the south side of town, the chambers of commerce. The biggest changes I see, access to education. We've got Texas A&M San Antonio along the southwest quadrant of San Antonio, providing bachelor's, master's degrees. We have, of course, not just a community college on the southwest side of town. We have the best in the nation community college district in San Antonio, and now a medical school. In the area of medical care, we didn't have hospital access on the southwest side of San Antonio when I was a young man, and now we have Mission Trails Baptist, we have Southwest General, two hospitals that I personally worked at, and then the Diabetes Institute on Zarza Moore, which is a state-of-the-art diabetic center. Of course, all the economic development that's occurring, the jobs that are available in the healthcare industry, at Toyota, it's kind of jobs where people can earn the cash flow and the income, not just to support a family, but to build wealth and to build wealth for generations to come within their families, to provide opportunities for their children and grandchildren. So it's been remarkable changes in the south side. There's a lot of work to be done, obviously. It'll be a continuous work throughout our lifetimes and beyond as needs arise.